So how does that affect, with you moving from wows to mounted arms, how does that shift the influence for infection prevention?
Um, I th I think it just changes the form factor,
Okay.
right? And then the WOW has the whole bottom of it that's so hard to clean and everything else. By keeping stuff waist level or above, it makes it easier for EVS to clean, manage, and then disinfect the room.
This is a big issue that a lot of people don't talk about, but if you've got a PC on a workstation on wheels, there's a fan in there, right? And you're moving from room to room potentially, and you're sucking in pathogens and then spitting them out somewhere else.
Yeah,
And so by having fixed mount, right, I would assume that
right.
it's a benefit for infection prevention.
It is.
Yeah,
And then
because
we don't have much equipment that translates and goes from room to room. My people go from room to room, but my equipment primarily does not.
right. So we've also seen that in infection prevention, the disinfection process can have a negative impact on the longevity of equipment. Um, is that something that you consider? And are you using any of the Seal Shield products to help improve the longevity of your IT equipment?
Yeah, so again, going back to the equipment that comes with the device, the chemicals just wipe it out. One of the biggest things that gets affected are those screens. And so we've been using your Seal Shield screen protectors, especially in our ORs and other places like that, to just to save the longevity on those screens as well as do the impact protection on it. I mean, everything on here, those screens just there's tremendous risk for both impact. The light can fly into something, and they're tremendously expensive to replace, like $30,000 and up.
Well, Jess, I know this isn't a problem at your facility, but I tell people that most hospitals have a dirty little secret that they have a room somewhere where they have hundreds of thousands of dollars worth of equipment that they destroyed with a cleaning wipe on the screen. And the equipment's functional, but they can't see it anymore.
Fogged it out. Yep.
That's fogged it out.
Yeah.
And so the screen protectors are actually uh, uh, providing a benefit for infection prevention, but also for the IT longevity.
Right.
So I think it's great that, and I understand as an IT guy, why you're concerned about the IT longevity.
Yep.
Do you think on the infection prevention side that that's something they consider?
Um, Probably, I would hope so.
Yeah.
Is what I will say. But as we go through with the screen protectors and everything like that, it really is how can we give it more longevity? And the next screen protector of yours that we'll be using is the privacy screen protectors for our screens that are in the hallways, trying to keep that passive observation away in your screen and how it just disappears on there. It's not this big ugly frame that the staff is just going to remove. That'll be a next step for us there.
And that's a pain point. Maybe you can tell our audience that they don't realize, but there is some HIPAA requirements that certain screens need to have privacy protection so that patient data is protected. And the main product today, as you said, either hangs on the screen or it has a tab. And the reality is the clinicians don't love privacy screens because they distort the view.
Right.
So they throw those away. And then you either have to replace them or fail an audit, right? So
Correct.
this is a big pain point.
Yeah.
And because the Seal Shield screens are custom cut, it's not intuitive that they're removable. They're semi-permanent, and it's solving that problem for you. Is that what you're seeing?
Well, it's not only that it's not that they don't remove but you can actually see through the thing.
Yes, it's more
The ones that
visible.
are on the frames, what it does to the screen and everything about the use on it is just terrible, right? The end user experience on it is just horrible, which is what drives people to take them off and remove them. So,
How do you think that the product choices that you make affect maybe the way that infection prevention approaches their job? Is it what is the training process to say, hey, we have washable keyboards, so you're taking an extra step? Because in a lot of facilities, they don't want EVS to touch any of the equipment,
yeah,
right? So
yeah.
how do you address that challenge? Is that something that's trained for and making things easier to clean and allowing access to EVS to some of this equipment?
Well, I think it's when you're in the early project planning, you engage with all those partners and you start to develop those workflows ahead of time. And then you plan for the equipment that you're going to need. Um, because you have to have the right washers to be able to wash the equipment, educating them and how to do it, all the rest of that. So it really is engaging in your EDS leadership, your infectious disease leadership ahead of time, and making them a partner in that process.
Collaborative approach.
Absolutely.
And when you identify a solution that works well in one building, how do you decide whether to scale it across the other facilities?
Yeah. So this whole campus here was really a new experience, a new um, everything about it was brand new, right? And so now we're going to go into spread. And now we're going to take the concepts that we learned here and we're going to push them into our Orange campus as well as our community network hospitals. And so everything, it's first proof of concept, validate, verify, and then spread.
Okay. So, yeah, identify best practices, best products, and scale it.
Yeah.
Fantastic. Well, we've talked mostly about hardware so far. Any innovations on the software side?
So a project like that's this big and this complex is a bear to just take on. And one of the tools that we really used in planning it was a platform called Zycon. XY icon is kind of how it's spelled. And what it enabled us to do is really to take the architectural drawings all the way down to the low voltage drops in every single room, and then partner against each one of those drops. What equipment are we planning on putting there down to the accessories? So this will have this kind of a computer with this kind of a monitor, a barcode scanner, a printer, all the different components to it. Use that to do your station validations. That rolls up into an order. So now I know how much product to buy. Then you deploy against that. And from that, because it's tied back to the port, I know my patch list for what I need to patch back in the data closet. And you can even follow it through to the switch. So I know in the future, if I go to replace a switch, what equipment am I going to take down when I pull that switch?
Wow.
And then deploy against that, and then in turn, finally hand it over to operations to maintain and sustain, tie into ServiceNow, and to keep those records current for what equipment is deployed where. And so now we have an accountability of everything. How many X's do I have? How many Y's do I have? How much did I spend? What was my cost per room? And all the rest of that. It was tremendously valuable, both from
So
planning, deployment, activation, and then handing it over to operations.
fantastic. Wow, what a tool. So you have new construction. I'm curious about when you're building a new building, what the infection prevention influence is. Is it coming from the architects? Is it coming from IT? Or are the infection preventionists involved in the actual pre-planning of the construction?
Yeah, so our infection prevention team was actually involved throughout the planning process. And anytime we go to take a design, validate the rooms, the room locations, where the ergonomics of it, where the different things are going to be located. They're involved through that whole process right there. Um, and they're a tough customer.
Well, that's fantastic. So
They're hard to keep happy.
I bet. Well, good. Yeah, I'm glad
Right.
to hear
They
that.
keep us honest.
Let's
Yes.
start things
They,
out the right
they
way.
keep us honest.
So do you see digital mapping and planning tools as part of the larger patient ecosystem?
Um, as far as like RTLS, real-time location
Yeah,
services,
that
or
kind of right.
so it's funny, I was having this conversation. I think it's probably great for biomed that can go and find all of their stuff. Um, I'm not convinced yet that it's going to get there for the end user, because I think we all go back to our caveman roots and just hunt and gather the tools that we need. Unless you can make it readily available and accessible to go find the equipment. So
So, um, what about AI?
mhm.
Are you guys?
The
What
whole
is it?
show feels like it's AI this, AI that, right?
Okay.
Everybody's got an agent. Everybody's got a cute name for their tool. I think it's amazing, and I'm really excited about um, it making healthcare accessible again. To my mind, the EMR has been a great development, but it's a giant data sheet, and people don't think in data sheets. They think in stories. And so I think AI gives us an ability where it can take all of that data that's in an electronic medical record and make it accessible for people again. Um, whether it's a charting summary, whether it's a communication tool, end of shift reports, all the rest of that, as well as just automating some of our processes with the ambient listening, things like that. I think there's tremendous possibilities that are there.
Well, I like to ask my guests often, if you had a magic wand, what would you change? But I feel like you're at the front of the change. So you're getting to do that
Yeah,
all the time. You're
yeah.
getting to lay out the way you want it to be. So let me shift it a little on you. If you had a crystal ball, what do you see for the future of healthcare in general and particularly at UCI?
Um, so I think we've been starting down the road of staff mobility and really knitting together the ecosystem on the inpatient side. One of the things for UCI Health that we're really interested in doing is trying to take some of those investments in enterprise architecture, whether that's nurse call, the EMR, all these different components, and now really see what can we leverage on the outpatient side and the ambulatory side. Because in many of the clinics, they're functioning the same way they have for the last 30 years. They don't have the mobility phones, they don't have tablets, they don't have um, any kind of middleware that's helping automate alerts to people. So can we take some of these tools from the inpatient side now, because we've built it as an enterprise architecture, not a building specific architecture, and then push that to the ambulatory environment and push those experiences both for productivity, patient experience, and then safe and effective care.
Fantastic. Well, I know you're a proactive advocate of infection prevention solutions like Seal Shield.
Yeah.
You're building these hospitals from the ground up with input from infection prevention. In this process, is there something you've seen or thought about that said, here's an area we're still not addressing? Where do you see those areas for infection prevention that maybe we need more focus or more innovation to address some of those challenges? You see anything like that?
Um, well, I think as the environment continues to change, we do really good job at terminal cleaning, neatening up the room a little bit, but how can we sustain a clean environment? And how can you monitor or prevent the pathogens coming in from visitors, from guests? And again, in the ambulatory environment, you think of an MOB waiting room where everybody has the sniffles, right? And everybody's coughing and sneezing. How are we controlling those and not turning that into a giant petri dish where everybody's sharing the germs?
It's a great
I think those are some spots that we could
It's a
get
great
after.
point. And we saw Dr. Wang talking about his technology here, but you can clean the room, and as soon as someone comes in, you've changed the bioburden, right?
Right.
So those are interesting challenges. Well, Jess, is there anything else you'd like to share with our live hymns audience here today?
No, it's been a great show. I really enjoyed hymns this year. Great partners with Seal Shield. Happy to be here. And thanks for the opportunity.
Well, we've been thrilled to have you, Jess. Thanks as always. Really appreciate it.
Thank
Give
you,
a
sir.
big round of applause for my guest, Jess Langerud. And for my guest, Jess Langerud, I'm your Clean Talk host, Brad Whitchurch, reminding you to keep it clean.